Hello, Facebook. This is Dr. Brett Spradlin, and this is Divine Design, and we've got a room full of crazy people here. Give them a shout. Ready? Yay! Yes, I finally found all the crazy people. All right, so we're talking tonight about some interesting stuff. The title of tonight's class is Diseases Fabricated by the Medical System. I talked about this a few minutes ago before we went on camera. I'm not here to make anybody feel bad. I'm here to wake people up because there's a specific problem that we have in America right now. You hear it every day in the news. The healthcare epidemic, the healthcare crisis. We don't have a healthcare crisis. We have a disease management crisis because there's no such thing. There's no healthcare going on right now. Are you kidding? You're out of your mind. We have every drug, every surgery, every vaccine. Yet the kids are sicker and projected not to outlive their parents. If you were here 2 weeks ago, anyone here? This room 2 weeks ago? Yeah, a few of you. We talked about nuggets and goldfish and candy, oh my. And we talked about how the kids are sicker now than they ever have been. But they have all the surgery, all the drugs, all the vaccines. They're looking at putting kids on the cholesterol meds, the blood pressure meds. They already got them on the Adderall meds and all of the attention deficit meds. So the kids, if you don't do something and finally take the bull by the horns and wrestle this thing to the ground, they're coming for your kids and your grandkids and your nieces and your nephews if you don't do something, right? We talked about how just a few minutes ago, America, the most technologically advanced country on the planet, but we're the sickest. How can that be? When you go to other countries, they make fun of us, how we look, the food we eat, the number of drugs we take. How many of you have been overseas and you've heard the fat American jokes, right? Yeah, I know I traveled through Europe for a summer, and I would know if someone, this was years ago, but I would know if someone was American by seeing them across 100 yards away. I knew it, and sure enough, I'd prove it to myself, and I'd walk up and I'd go, hey, where are you from? Well, we're from Minnesota, don't you know? And I'd say, oh, great, I'm from Michigan. Cool, nice to meet you. But you could tell from a mile away, and I hate to do that. I hate to say, well, that's how Americans, they stand out of a crowd, but they kind of do sometimes. Y'all know what I'm talking about? Yes, you've seen it. You know what I'm talking about. You go to sports rallies, you go to football games, you go to movie theaters. We have an epidemic of, we call it, in medicine they would call it obesity, but really we have an epidemic of malnourishment because we have an epidemic of Golden Corral. Oh, go to Golden Corral. I haven't been there in quite a while. What are you doing there?
I don't go.
Oh, okay. He says go to Golden Corral. And I'm saying, what's he doing going there? You're a patient. What are you doing going to Golden Corral? But no, you're doing well. All Ted does is eat at Panera. That's all he does.
And home.
And home. But we have an epidemic, and it's not so much an epidemic of obesity. How did the obesity is an effect. It's not the cause. Obesity is the side effect of malnutrition. If your body is hungry, you will continue to eat crap food. And if you continue to eat crap food, you will continue to gain weight. You will continue to get bigger and bigger and bigger. It's not a genetic thing. It's not a hormone thing. I heard it all my life growing up. Well, don't pay attention to, she's bigger. It's a hormone thing. Or don't pay attention to, it's not his fault. He's crazy. It's a chemical imbalance. How many of you have ever been to my chemical imbalance class? Yeah, that one's coming up pretty soon. I'm thinking about doing that one over the summer. Chemical imbalance, no such thing. Yeah, we talk about that for about 1 or 2 hours, and that'll blow your minds. No such thing, no chemical imbalance has ever been recorded in the human brain, but you've heard it your entire lives. You've got relatives who've been diagnosed with a chemical imbalance. You've got people in your family who've been diagnosed with a hormone imbalance. It's always the person's fault or genetics. See? But what I'm bringing to you tonight is diseases fabricated by the medical system. I'm going to show you very simply and very easily that half of these diseases that you think exist are just a figment of someone's imagination. Does that sound like a challenge? Is it the disease you have? Is it something you've been diagnosed with? What if you've been diagnosed with something that wasn't even real? How crazy would that be? Well, here, let me read you a few things right here. I'm going to introduce you to a few testimonials, just to show you what the road we're going down. Just that I'm not up here just talking smack. I'm up here with a little bit of experience, and I kind of know what's going on with a lot of people. We watch everything from their bowel movements to the food they eat. We watch what drugs they're on. We watch what nutraceutical megadose synthetic stuff they're taking from Walgreens. And then we slowly, over time, supplement their body, rebuild their organs with all natural whole food supplements made by God, but formulated and put into a capsule or a tablet form by man because it's no longer in your diet. How genius is that? You never heard of this, have you? We also use cold laser to stimulate the genetics of your cells at the DNA level. We also use, I'm a trained chiropractor, by the way, so we turn your lights on by adjusting every joint and bone in your body, which just so happens to be surrounded by every artery, nerve, vein, lymph node, and nerve fiber in your body. Has nothing to do with cracking bones or popping necks. Thank you very much. I hate that term. Please stop using it, everyone. But there's a lot more to chiropractic than neck pain, back pain, and headache. It is the original laying on of hands, and it is the largest natural health profession on planet Earth. And without chiropractic, you and your access to drug-free surgical care would be gone. You know that, right? If there were not chiropractors in natural health, your only options in healthcare would be drugs and surgery. Do you understand the power and the importance of this? Even if you didn't want drugs and surgery, if there was not natural health, of which chiropractors are the leading by number in out there, natural health profession on the planet, if that was not there, your only options would be drugs and surgery. So this is very important. And we also do detoxification. If you read that article in your folder about detoxification, the 4 pillars, detoxification is one of the pillars. So it's chiropractic, cold laser, detoxification, nutrition. In other words, chiropractic, big structures, cold laser, small structures. So we're stimulating both. Detoxification gets the bad stuff out. Nutrition gets the good stuff in. Guess what? You win every time. It's the cheapest form of healthcare. I shouldn't say cheapest. I should say most affordable form of healthcare you're ever going to find. So let me just read you a few testimonials. Oh, this is a nurse right here. As long as I can remember, my sinus issues have affected my day-to-day life. I was constantly stuffy, congested, in and out of doctor's offices getting steroid shots. Does that sound familiar to anybody? Getting steroid shots and on allergy meds. Now I have no issues with my allergies. How many of you know it's allergy season? There's no such thing as allergy season. Guess what? One of the things that Fabricated, there's no such thing as allergy season. It's like flu season. Is flu season really a season? Or is the flu just a bug? Isn't it interesting that anytime you talk to somebody about can you get Sheila poor thing, can you get her a folder so she can block the sun?
That's okay.
Aw, well, we got to take care of you, darling. Isn't it interesting that anytime after Halloween, you mention something to somebody and they go, oh, that's holiday time. I don't know, I'm going to be busy. Same thing. Anything from Halloween to like middle of January is the holidays. Don't plan on anything happening. People have holidays, they have vacations, they have kids things, they have this and that. It's the same thing with flu season. Flu season is just a big global warming for your immune system, isn't it? Flu season is just this one big excuse for everybody to go, oh, there's a bug going around. No, you just don't have an immune system. That's really what the problem is. There's bugs always going around. Is it flu season because it's cold outside and the bugs come out of hibernation? Think about this. Think about what we're told. Flu season, go 6 months forward. Now it's allergy season. Go 6 months forward. Now it's flu season again. Right? Look at the pollen count thing on your phone. Everybody's like, oh, the pollen's high. I'm sneezing. How come not everybody? If it was really that big of a deal, why isn't everybody sneezing? Think about it. Let that drop for a minute. Let that sink in for a minute. Right? If allergies were that big of a deal, wouldn't everybody be sneezing? So here's a nurse saying no more allergies. This is the first year I've not had to get shots or take meds. This is a nurse. First year, no shots, no meds. Headaches have gone away and I can finally breathe without supporting big pharma. Love you guys. I didn't say that. She said that. Here's a good one. She wrote it so big because how many of you know if somebody has insomnia and they can't sleep, they can't heal? Kind of an emergency deal, isn't it, Facebook, if they can't sleep? Insomnia is gone. There's a myriad of other things that went away. But when you get rid of somebody's insomnia, or I should say you fix their body so the insomnia goes away, guess what? They feel a lot better. They want to name bridges and schools and parks and stuff after you. You know, I don't let them. Maybe one day, but not yet. This is somebody in the healthcare field as well too. I came in for a visit feeling really bad. Oh, this is after her first adjustment. So if many of you think that this is just about, if anybody here is thinking about, oh, it's just about popping necks and cracking backs and stuff like that. I came in for a visit feeling bad. In an effort to give me a little TLC, Dr. Brett gave me an adjustment, even though one wasn't scheduled for that visit. I came in planning on taking meds to help with the pain after I left, but after my TLC adjustment, I didn't feel like I needed the meds. I even had enough energy to go for a walk with my kids, and if you knew her situation, you would go, wow, that's interesting. And play outside with them that afternoon. Thank you so much for the beginning of health in my life. That was after her first adjustment. After only 2 weeks of coming to Dr. Brett, I no longer take any of my 10 medications. You read correctly, 10. That's what he said. People are asking me why I look different, better color, happier. How many of you know if you come off your drugs, you start looking different? You get handsomer. You get handsomer. I'm telling you, yeah, I'm sure. I tell them, well, let me tell you about Divine Design. Usually I dread going to the doctor, but I love coming to the office to see everyone here, all the people I introduced you to. He loves these people, all these people. So let me just say, Facebook, I don't recommend anybody come off their meds. I'm not a medical doctor. I do not prescribe poisons, so I don't take you off the poisons. I just get you so healthy that you don't need the poisons, because they're all poisons. And anyone who tells you otherwise is either lying or stupid. They're all poisons. Test me on this. Take a whole bottle of them and see what happens. They're all poisons. Even Tylenol. You follow me? Take a whole bottle of that, see what happens. I went pescatarian for 2 years ago after feeling my body sluggish after eating so much meat. When I first cut out meat, I felt wonderful, so I kept the diet up, only eating fish, no land animals. That's what pescatarian means. I had to define that word for some of you. About 2 years ago, when I started noticing my acne getting worse, after seeing Dr. Spradlin, he suggested I try to add some meat into my diet again. I have improved a whole lot seeing Dr. Spradlin, but after only eating meat for 2 weeks, I've seen a huge difference in my vitality and my skin. There are only a couple types of groups of people, or a couple groups of types of people, that I have a really long discussion with before we get started, if we get started, and one of them is vegans and one of them is vegetarians. She was both. So she kind of took a while, but we got her eating meat again, and all of a sudden that acne started going away. She started getting her energy back. Very cool story. Here's, let's see, 3 weeks of coming to Divine Design. Dr. Brett adjusted my lower back when I was complaining about sciatic pain. No more pain, thank you. I've had sciatic pain going on 10 years. It's actually what led me to find Divine Design Natural Health. I started having numbness in my hands, and that disappeared. My blood pressure's lowered to where I've reduced my meds. Thanks again, Divine Design. Boom. I'm so pleased to be off 2 of my blood pressure pills in approximately 6 weeks. Once again, I do not pull people off their meds, but guess what? Even the doctors can't force you to take them. I'm not pulling you off your meds. You just finally woke up and went, I don't want these. Is that illegal? No. But if I pulled you off of them, that is illegal. They'd come take my license, throw me in a FEMA camp, we're all done. That's why I don't say it. But you can do it. I feel better and love the whole food supplements replacing synthetic junk pills. Oh, that's hilarious. A couple more here. After coming to Divine Design, my health has improved, my attitude has improved. When I began, I had an ear that was stopped up, and now I can hear clearly in that ear. It was not an immediate change, but after changes in diet and lifestyle, it has cleared up. Also, I can now come in with a food log that's not a total disaster and full of red marks. That person took probably a year, maybe better part of a year and a half to clean up her diet, which was the really big thing that was making her sick. Adjustment today was eye-opening. I feel so good immediately after. Lots of endorphins. First adjustment. That's a dear friend of mine who's another health professional here in town. This is more energy, feeling great. Food tastes better. Smells are more vibrant. This is after the purification program. We do a purification program with people. We get their taste buds back. We teach them how to eat real food. The real food is kind of, one of those lost definitions. People don't know what real food is anymore. Everything's packaged, canned, processed, boxed, microwavable, blah, blah, blah. Well, howdy, folks. Come on in. Is there room back there? Oh, okay. So that's real food. Mom called 30 minutes after they left. Daughter was pain-free for the first time in a week, and her appetite returned as well. That was just from supplements. That was just from giving her the right stuff so her body wasn't starving. Let's see. In 7 days, asthma, coughing has gone away. Lymphedema in the lower extremities. How many of you know what that is? Legs all swollen up, lymphedema. Down significantly. Fatigue is decreasing, much more energy. Decreased joint stiffness. TMJ has improved 50%. Bilateral shoulder pain, 100% improved. 9 symptoms went down in 7 days. Boom, there you go. I started at Divine Design Natural Health March 14th. Since being seen by Dr. Brett, I am virtually pain-free, have lost 30 pounds. This was March 14th. Okay, yeah, so pain-free. I've lost 30 pounds and have more energy. Even though we were in a car wreck 3 weeks ago and totaled our car, my husband has lost 20 pounds by following the same diet as I'm on. He's not even a patient. Can you believe that? That's how it always starts. The wife comes in, and the husband kind of holds out and says, well, you know, this guy, I don't know who this kid is, you know, let's just see how it works for you. He uses the wife as a guinea pig, like you guys. Exactly. Exactly. Thank you. And they say, right, Faye? Right, Faye? Yes. So they use the wife as a guinea pig, and they say, well, if this kid works out and he knows what he's talking about, then I'll get on board. And as the wife starts losing weight, and she starts getting on board, and the color starts coming back, you see the guy kind of going, uh-oh. A lot of times. We've been giving our dogs the canine supplements in their food. Yes, we do dogs. I'm not going to read this whole thing, but this is great. Dogs just acting happier, not pooing all over the place, no projectile diarrhea coming out of the puppy. It's very nice. We treat dogs, we treat cats, we do horses, cattle. I mean, they all work the same. It's the same physiology. So I'm not a vet, but you know what? Hey, if you're a patient here and you want your dog treated, guess what?
We take care of them.
And everybody here is a total animal lover. Everybody here. Last one here. I've had trouble breathing through my nose for years, especially when trying to sleep. After one visit, I was able to breathe clearly and could sleep without my mouth open. How many of you know that's a game changer right there? Acute sinus infection, 3 supplements for a month. I was able to come off them when the Bradford pears began to bloom. How many of you know Bradford pears? Everybody's nodding. That's a big thing here? Bradford pears. Okay, I didn't know. Wow. I didn't know that. When the Bradford pears began to bloom in the spring of 2018, I was able to come off of all the meds. I had no recurring allergy flare-up for the first time in 20 years. We were just talking about the allergy thing. After many years of dieting, I've tried every diet, blah, blah, blah. I've been carrying around weight for the last 50 years. I finally figured out the diet Dr. Brett clued me into. I mean, she's losing weight like it's going out of style. So those are just a few little home runs that we've had. Those are just a few little testimonials. But what I want to get into is all of these diseases that I'm talking about, everything right here. Do you think any of those things they were told that they could be rid of? The allergies? That's shots for the rest of your life, right? Or until you, quote unquote, outgrow them, right? Or the depression or the anxiety, that's a chemical imbalance that then you're on psych meds for the rest of your life, right? Let's see, heartburn, indigestion, all of the gastrointestinal stuff, Crohn's disease, irritable bowel, all of that stuff, heartburn, you're on Zantac, you're on Prilosec, you're on Prevacid for 30, 40, 50 years, right? Everything right there was basically something that was either fabricated or something that they were not told the purpose, not told the reason why it was there. In other words, if you don't know how something starts, how do you know how to get rid of it? If you don't know the cause, how are you going to get rid of it? Well, you look at the drugs, you look at the surgeries, you mask it and cover it up and make people think it's not there anymore, right? You take the battery out of their smoke detector. That's what the opioid epidemic is doing right now. You know that, right? You take the battery out of their smoke detector, and does that stop the fire? No. Nope. It just stops you from smelling the smoke. It stops you from hearing the signal. And that's what the opioid epidemic is doing right now. And let's back it up 50 years. That's what the Tylenol epidemic did 50, 60 years ago, right? You've got pain. We're going to give you something that shuts off that pathway, the neurochemical pathway in your body, the pathway that tells you something's wrong. We just snip the wire. We just take the battery out of the smoke detector. We take the fuse out of your check engine light, and you just keep driving down the highway. And then your tires blow off, and you're wondering, what the heck? I thought I was perfectly healthy. I went out for a jog, and I dropped dead of a heart attack. Well, you weren't perfectly healthy, were you? You've heard that story. He was perfectly healthy. He went out for a walk and retired, and 2 days later he fell over dead, right? You've heard that. So was he healthy ahead of time? Nope, but I bet you he was on a handful of meds that absolutely suppressed his body from being able to tell him that there was a problem in the first place. Does that make sense? You've all heard these stories. So some of these things are massively, oh, we did go through these. Oh, these are big. These are big. I'll get to those at the end. Those are big. So let me just read you a few stories here, or a few stats. I love stats. How many of you like stats? Everybody. Everybody likes stats. Now, some of these stats are old, as best we could find, but CDC.gov, which is the clearinghouse for truth. I'm just kidding. 7 in 10 U.S. adults, this was in 2016, with high blood pressure are on blood pressure meds. 7 in 10 U.S. adults. So that's 70%. With high blood pressure are on blood pressure meds. Now, I think that might be a little bit higher. So WebMD says in 2009 that 62% of U.S. adults were using blood pressure meds, right? Which is close to the 70% that the CDC said 7 years later. Blood pressure meds, the CDC said in 2016 that 7 in 10 U.S. adults. Statins, CBS News said in 2014, 25 million Americans. Think about that now. 25 million Americans, statin drugs. You're taking one of those a day, 365 days, times 25 million. Do the math on that. That's just Americans. Think about that. Then anticoagulants. How many of you know thrombolytics or anticoagulants? Blood thinners. Okay. 4.2 million Americans. That was 12 years ago. That was in 2007. So diseases fabricated by the medical system. Let's just make a list. And we'll just say blood pressure, cholesterol. Anybody want to add to this? That can exist. That actually can exist. But you can fix that differently than what they're saying. And I'll just put decreased. I'll just put a blood thinner deficiency here. So 3 things that really don't exist is high blood pressure. What do you mean that doesn't exist? Everybody's got that. Yeah, you're right. Everybody has it, but it's not because of why you're being told it's there. Who can tell me why do they tell you that people have high blood pressure? Out of everybody. Now, don't tell me what we know it is. Tell me what the people you know who have high blood pressure have been told is causing the high blood pressure. And you're going to see a pattern here.
Constricted arteries.
Could be, which would go with blockage, right? We'll call that stenosis, or a narrowing of a tube. That would be called stenosis, right?
Yeah.
Hereditary. What was the other thing, Andrea? Genes. What else? Oh, yeah. Yep. Stress, yes, which would be stenosis, which will cramp your arteries, right? Okay. We're just going to come up with blood pressure. Arguably the top thing that people go to doctor's offices with. The number one thing that you, your grandparents, your aunts, your uncles, your parents, now your kids are being diagnosed with, right? Anything else? Anything to add? I'm just going to write this up here, and that's probably too small. Some of you can't see it, but we've got stenosis, genes, increased fat in your diet, and stress. Anything else? That would be increased fat in your diet. We'll call that the same thing. We'll just call, you know what? We'll just call that diet. Yeah, that way that would get the fat thing, and that would get the obesity thing. Anything else? Okay. So if you've got blood pressure, high blood pressure, if you've got half of America, let's just say half of America, on blood pressure meds, some of them on 2 or 3, and they still have high blood pressure, right? But you're being told that it's an artery thing, or you're being told that it's genes, or you're being told that it's diet, or you're being told it's stress. If you're on those meds, right, and you don't quite know what's causing the high blood pressure. Let's just say it's high fat. So you try cutting the fat out of your diet. Does that change your blood pressure?
Might make it worse.
Might make it worse. So then you start thinking, well, I'm screwing stuff up. I better stop. This, I better stop this this low-fat diet thing. It's getting worse. Or you don't make any correlation. Next time you go to the doctor's office, your blood pressure is worse. Then what do? Increase your medicine or give you another prescription. Is there anything else? I'm not making this up. I mean, this is simple math, man. You've all been through it, right? Hello. They either up your prescription, your dosage, or they give you another prescription. That's how you end up being 75 years old on 4 blood pressure meds, but you still have high blood pressure. Guess what? We just ruled out this one. We just ruled out this one because your blood pressure is getting worse and your parents are dead, right? You would have had high blood pressure from the time you were a baby if it was genetic. Let's just face it. Duh, right? So the stenosis, well, yeah, it could be stress because when you get stressed out, your arteries, but how about your arteries constrict? It depends on what artery. If it's to the outer part of your skin, they constrict. If it's to your muscles, they dilate. If it's to your organs, they constrict. Depends on where in the body. Not all your arteries constrict or you just dry up and blow away. Or you just pass out and die. But see where I'm going with this? The blood pressure thing, what could possibly be causing so much high blood pressure in so many people groups across such a vast demographic, across thousands of acres of land mass, across the entire world? What's causing the blood pressure? Now, before you finish that thought, think about what else could it be? Just think about it. What else could it possibly be besides food? Well, which is in the food. What else could it possibly be? I tell people there's 3 things that screw up your blood pressure: breakfast, lunch, and dinner. So you were kind of right on the money, my man. You were kind of right on the money, but they're telling you it's the high-fat diet without telling you that humans have eaten fat and protein for 6,000 years. But guess what? They haven't eaten sugar for 6,000 years. So do a high-carbohydrate, low-fat diet. You heard that 40 years ago, right? What did that do to everybody? The women now are all infertile. Everybody's got a chemical imbalance. Parkinson's and Alzheimer's are going through the roof. The kids have autism. Guess what happened? You got lied to. So that tells us about this one, doesn't it? High cholesterol. Everybody's got high cholesterol. Good grief. First of all, let's finish this one. The whole high blood pressure thing. If they don't tell you what's causing the high blood pressure, how are they going to fix it? If they don't know what's causing it, that would be like taking your car to your mechanic. Being like, well, I don't know. My tire keeps getting flat. Well, it's the oil filter. No, my tire keeps getting flat. Well, I'm telling you, it's the oil filter. You don't understand. My tire, what does the tire have to do with the oil filter? My tire keeps going flat. It's always the oil filter. It's always the oil filter. Think about the lunacy of that. Would you go to your mechanic if he tried to tell you that? But you continue to go to your doctors that are telling you the same thing. Isn't that nuts? They don't know what's causing it, but they're going to give you one drug, then they're going to give you another, then they're going to give you another. Now, then they're never going to explain to you why all 3 of those drugs they have you on are actually causing more problems with your body because of their toxic chemicals. They never tell you that, do they? They never tell you that. You know what we do here? It's worth it. The benefits outweigh the risks is what they tell you. You're right. Thank you. So then, before you know it, they're not telling you the real cause of it, and then that's leading to this. Because now you got high cholesterol. Well, we got a problem now. So we got to put you on a statin drug, which means you now are taking another toxic chemical to lower cholesterol. The only problem is cholesterol natural in your body or unnatural? Natural. It's natural in your body. So you're taking an unnatural chemical poison to lower the amount of something natural in your body. How screwed up is that? It's demonic is what it is. Let's just call it what it is. That's screwed up. Your brain's made of fat, your nervous system's made of fat, so everything in your body that's made of fat is now going to take a big fat hit because you're taking a drug which will lower the naturally occurring cholesterol in your body, take out part of your liver. That's why they give statin drugs with CoQ10 now, because they started realizing, well, the statin drugs are killing the liver at such a rate, we have to put CoQ10, coenzyme Q10. I'm sure you've read about that. You heard about that. So you have to put statin drugs in with CoQ10 in order to not kill the liver too fast, because when you do statin drugs, they have to check your liver enzymes to make sure they're not killing you too fast. That's why they take your liver enzymes. You get that? How many unnecessary tests and blood panels and all that stuff? How much is Medicare paying on that? Just because of this. Cholesterol is not a disease, folks. Cholesterol you got to have. Cholesterol is a sign of something very, very good in your body. And along with this right here, as much as this number goes from or wait, what's normal cholesterol now? 140? I can't even remember. I don't even pay attention to it. But blood pressure, if it's not 120 over 80, well, we're going to put you on a, or if it's 140 over 90 or whatever, we're going to put you 3 times in a row as the clinical, we're going to put you on a blood pressure med, something to artificially screw up your blood pressure. Then if cholesterol is under, if it's not under a certain number, we're going to give you a toxic chemical so that we can manipulate it so that on a blood lab you'll look good. But how many of you ever know anyone, this is the biggest thing right here, God, this is huge. How many of you ever knew anybody who took a blood pressure med, took lisinopril, or took metoprolol, or took took a blood pressure med, and then came out and said, hallelujah, I feel so much better? Raise your hand. Okay. How many of you ever took a torvastatin, Crestor, or Lipitor and said, oh, now that I have my cholesterol under control, I feel so much better. My headaches are gone. My back pain's decreased. I can sleep at night. How many of you have ever heard of anyone that ever said any of those words? Raise a hand. I'll wait right here. Anybody? No? So if these numbers or these numbers are crunched into a smaller category, does that mean that the number of drugs sold for those things goes up or goes down? Goes way up. So if normal cholesterol, which used to be in the 3s and 400s, goes down to, let's say, 180, if we just drop it another 10 points, will that increase the market share of Lipitor? Mm-hmm. But we already determined that this is not the problem, right? Your doctors will stop at nothing to convince you that if you don't take a cholesterol-lowering drug, your heart is going to slam shut with a big old chunk of cholesterol and you're going to die. But in the meantime, they're making you sick as a dog and putting numbers on a blood lab that make you look good according to numbers, but then you're sick as a dog the whole time. I teach a class called Life is in the Blood. It's all about functional blood chemistry analysis and showing how functional blood chemistry is this small range. Pathological blood chemistry is this big range. See? So when you're looking at these numbers here, most of the time you're dealing with pathological blood chemistry. Let me ask you this. All the labs around here take averages of all the numbers. See, there's no standard human variation for these numbers. You know that, right? They're local. They're lab values from local geography. So does that mean, let me ask you this. Do sick people or do healthy people go get their blood tested? So if you have average blood labs, you're just averagely sick like all the sick people. So does that tell you what the blood labs are doing? Is the blood labs really, and here's the kicker too, you'll go pay hundreds and hundreds of dollars to get your blood labs, but you're on 4 or 5 meds. So is the blood lab that you just paid for really showing your blood, or is it showing your blood doctored to look good on paper? Ooh, I see heads nodding. Yeah? Funny, huh? You're not really getting a good snapshot of your blood. You're getting a good snapshot of your blood under the influence of A, a crappy diet, and B, 5 or 6 chemical poisons to make you look good on paper. Will Medicare pay for that? All day long. All day long. So we've already determined this, we've already determined that. These are the top 3 diseases right here. And you know people that are on all 3 of these. How do I know? Look at this. we have what is this here, this disease? This is high cholesterol, this is high blood pressure. This is a deficiency in blood thinners. You know people on 2 and 3 and 4 of these, don't you? And I'm going to tell you a little story here in a minute that'll blow your mind. Because a deficiency in blood thinners means that your blood's just going to clot, man. You're going to have an artery clogged shut in your brain. You're going to have a stroke. You're going to have an artery clogged shut in your heart. You're going to have a cardiovascular event. You're going to have a stroke. You're going to have a thrombosis. And then we're going to have to give you a big, giant thrombolytic antiplatelet blood thinner to emergency break up all your blood. And then that's going to predispose you to a stroke. I'll show you a little something. There's only two types of strokes, a wet one and a dry one. When you pop a hole in an artery, we call that a wet stroke. Is everybody tracking with me? It's called a wet stroke because the artery bleeds out and you can't clot and you bleed out. The dry stroke, or we'll call this hemorrhagic, and we'll call this thrombotic. That means hemorrhagic means, oops, there's a hemorrhagic, close enough, thrombotic. So this is a hemorrhage, which means you spring a hole. And this is thrombotic, means you have a thrombosis. And everything downstream of that artery goes dry because it's clogged with a clot. Does that make sense? Here's an artery. Here's an artery. You got a big giant clot floating from your, that's what a deep vein thrombosis is. That's what a stroke is, just a clot, can be a clot in an artery. A heart attack can be a clot in the coronary arteries, 1 or 2 or 3 of the coronary arteries. But a wet stroke, just to illustrate, is where you pop a little hole in an artery and then all the blood spills out into the surrounding tissues and you've got a wet stroke or a hemorrhagic stroke. You've hemorrhaged. Does that make sense? Everybody go, yep? Okay. Now, a thrombotic stroke or a dry stroke is where a clot's coming down and it lodges in the artery here, and the blood can't get through, and everything downstream dies out because there's no blood flow. Does that make sense? If you are prone to clots or if you have thick blood, they will give you a blood thinner, sometimes 1, 2, or 3 of them, or more. Tylenol being one, aspirin being one. How many people do you know who's on baby aspirin every day because it thins your blood? So artificially, think about the importance of blood, all you Christians. Think about this. The blood. You know what all this is doing, right? It's poisoning your blood. We're putting chemicals into your blood. The doctors are blood doctors. Think about that for a minute. Really let that sink in. Because when we're trying to artificially change the viscosity of your blood, we're changing your chemistry. Do you understand the importance of allowing someone on this earth to change your chemistry? Think about the ramifications of that. Everything in your body can be changed by one chemical substance. And everybody's nuts about, oh, food doesn't change anything, and oh, diet can't change. We know we are what we eat, but screw it. I'm just going to eat Chick-fil-A because they're Christian chickens. Thank you. But you're allowing someone to change your chemistry of your blood, which has to cause side effects. That's why every drug has a side effect. It's a chemical poison. It has to cause side effects. Think of it this way. Everything downstream has to be affected by the chemical poison. That's what side effects are. I'm not making this up. So, a dry stroke, you're putting 1, 2, or 3 blood thinners. A dry stroke clots up right here, and everything downstream goes dead, goes necrotic, it's a thrombotic stroke. That's why they'll call blood thinners that break up clots, they'll call them thrombolytics. That means thrombus, lysing. It means thrombolytic, means thrombo is a clot, lytic means breaking up, so they call them clot breakers, right? So you'll put 1 or 2 or 3 blood thinners in, Tylenol, acetaminophen, anacin, aspirin, all this stuff. They're all the same. Non-steroidal anti-inflammatory drugs. N-S-A-I-D, NSAIDs. Okay, non-steroidal anti-inflammatory drugs. Those are mild blood thinners like aspirin, acetaminophen, Tylenol, all this stuff, right? But then the other common ones are warfarin. It's right in the name, right there. You like that name? Warfare, in you, there is warfare. Look at that. They hide it right under your nose. No, that's not. Well, it is, but yes, the one you're thinking of is Coumadin, right?
Isn't Coumadin the same as warfarin?
Pretty much. One's brand name, one's
Yeah.
Nike, one's Asics. I'm not sure. There's a ton of them.
And Eliquis.
Oh yeah, yeah. Eliquis. Eliquis is my favorite. I have a personal little history with Eliquis. There's a ton of them. Plavix. Yeah.
So if you have a stroke, what do you do?
I'm going to tell you this. Watch. So there's two strokes, wet and dry, right? So what is the one thing that everybody says you have to have in order to avoid a stroke? Blood thinners, right?
Yeah.
Look at the problem though. If your blood is thin, if we want to get rid of this here, this clot here, you want to make sure all your blood's thin. Now watch. So okay, blood's restored. Now what happens if you spring a leak, but you're on 4 or 5 blood thinners? You're dead. How screwed up is that? So by trying to preventatively foretell the future, astrologically, and tell you that we're going to save your life by preventing a thrombotic stroke, we are automatically predisposing you, chemically changing your blood to a wet stroke. Correct or correct? How stupid are we to think that we're just going to change somebody's chemistry of their blood and not have any repercussions? Not have any, because you can remove a clot. You can live okay with, I'd rather have a dry stroke than a wet stroke if I was going to have a stroke. Think about it. But you bleed out, you're done. So are we saving lives? Once again, let's go back to what we talked about. America, every drug, every surgery, every vaccine. Are we living sicker or are we dying quicker? The answer is yes to both. Living sicker and we're dying quicker. Is the quality of life going up in America? Are people getting sicker and on more drugs and out of their mind and more shootings and more school problems and more road rage, more domestic abuse? Why? Had a little experience with this over, 2 weeks ago. 2 weeks ago. I'll explain that later. I'll explain that in a few minutes. We're going to talk about a little personal experience, but I do want to read through some things here, some other diseases. It's not just these 3. These are 3 that just came to mind right before doing this class because I have a whole list of them here, but I'm just going to read through a few. Sorry. I need one of these. As far as health goes, you have to think, if you just boil it down to something really, really, really simple like this, there's only 3 ways people can get sick. Somebody 100 years ago figured this out, and it echoed something that somebody 4,000 years ago had said, and they put it in a new way. They said it in a new way, and they said it like this. Thoughts, traumas, and toxins. The 3 ways people can get sick. In other words, emotional, physical, chemical. And this was hundreds of years ago before we had Monsanto. This was before glyphosate. This was before the new car smell. This was before vinyl chloride shower curtains. This was before all the drugs existed. You could break this down into 2 things and say increased bad or decreased good. Because if you don't have enough of the good stuff in your body, the toxins build up. Just hold your breath for a minute. If someone doesn't believe in detoxification or whatever, they think it's a bunch of hippie voodoo, I'd just say, go ahead and hold your breath for a minute. Let me know how that works out for you. Because all that CO2 builds up in your body and you have to expel it. That's what urinating does. That's what defecating does. That's what eating food. That's what all the metabolic processes in your body, everything has to be detoxified. Does that make sense? Anything that goes on your body goes in your body. So when you're slathering on your Jergens and your Victoria's Secret and you're spraying your thyroid with all these cancer-causing chemicals and endocrine-disrupting agents that people think are so innocuous, when you're slathering all the stuff on your skin, it's actually getting into your bloodstream. Hello? Where else is it going to go? You think it just goes and stays in your fat and then you pee it out? I mean, it has to go somewhere, doesn't it? Think about it. But they don't want you to know this. So thoughts, in other words, the way people think.
We love you, Ted.
Love you. The way people think. How many of you watching CNN every night? You want to know how much that's making people sick? Just the thought alone of just the words of their own mouth ensnare them. What's the biggest, most powerful muscle in the body of man? Tongue. If somebody comes into me and they're like, oh, I'm always like this, oh, it's getting worse, oh, I think it's getting worse, blah, 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 and their numbers are getting better, they're feeling better, they're looking better, well, I don't know if this is ever going to get better. I just stop them right there. Yo, man, shut up. Stop. Shut up. Nobody else ever told you this. Here's the problem. You've been saying it for so long, other people are afraid to tell you to shut up. Sorry, but shut up. Love you, now shut up. So thoughts alone are a big thing. Traumas, of course, you've got accidents, you've got, car things, people fall, slip, break ankles, that stuff happens. And this right here is where emergency medicine, this right here is the realm where medicine excels. This right here is the realm where doctors and nurses in emergency rooms go for it. You can sew that dude's arm back on that got ripped off in an accident, absolutely. But the other 99.9% of American healthcare that is not dealing with traumas, life care, EMS. I worked on National Ski Patrol for years. And when somebody's leg is twisted around facing the opposite direction, they're down in a tree well, and you've got to get them down 4,000 feet to, a non-ambulatory unit, and you got to keep them alive. Trauma is very nice. Trauma is very good. But when I worked in a hospital for 3 years, all the other stuff I saw, total garbage. So this right here is accidents. This right here is your physical. This right here is emotional. This right here, chemical. Think about it. Good stuff and bad stuff. When we talked about detoxification gets the bad stuff out, nutrition gets the good stuff in, we're doing both right here. So a toxin can happen from increased bad or decreased good, right? So think about this. Well, we won't get into inflammation, but all of the things that you know about, like the osises and the itises, arthritis is inflammation of the joint. Pancreatitis is inflammation of the pancreas. Thyroiditis is inflammation of the thyroid. See, the itis at the end just means inflammation. There's an osis at the end of a lot of conditions, like osis. I can't even think of one right now. Huh? What was it? Huh? Thrombosis. Thrombosis. That just means a condition of a clot. Thrombus, thrombosis, deep vein thrombosis. Yes, that's a condition of you have a thrombus, a clot in a deep vein, right? So osis just means condition. Itis just means inflammation. So when somebody says, I have, man, I went to the doctor, I got diagnosed with lateral epicondylitis. Ooh, that sounds horrible. What does that mean? It means this muscle right here is inflamed. Lateral epicondylitis, just a piece of anatomy. The lateral epicondyle right here means this muscle is torn and inflamed a little bit. Itis means it's inflamed. Sounds horrible, doesn't it? I hear this one all the time. Okay, so I'm just giving you these to show you a little medical terminology. This means, these words mean absolutely nothing. How do I know? Peripheral polyneuropathy. Peripheral just means far away. Poly means many, neuro means neuron, opathy means disease. So you've got a disease of the neuron, of many neurons, far away, usually in the feet. How many of you know somebody goes, they get their badge at the hospital? Well, I got back from the doctor and they told me I got diabetic polyneuropathy. They don't even know what it means, but they know how to pronounce the word, right? Because they've heard it so many times. They've heard it so many times. If you know what these things mean, and this just means inflammation, this just means condition, and this just means you've got a disease process going, all of these words, these 99-cent concepts are described by these big $10 words that then freak people out. So then they have this diagnosis, but the diagnosis doesn't tell you what's wrong. Does acute pancreatitis tell you what's wrong? Tells you the pancreas is inflamed. Tell you why? Just like the blood pressure thing. You got high blood pressure. You've got what's the clinical term for hypertension? Thank you. Gosh, I just blanked. Hypertension. You've got hypertension. High blood pressure, right? It doesn't tell you why the hypertension's there. If you have deep vein thrombosis, does it tell you why it's there? No. If you have diabetic polyneuropathy, does it tell you what the problem is? No. Not at all. So you just need to understand some of those. And if you hear something with syndrome, that just means, it just tells you that they don't really know what's causing it. So how many syndromes do you know? Oh, I don't know, carpal tunnel syndrome, chronic fatigue syndrome, irritable bowel syndrome, fibromyalgia syndrome. All of these syndromes, they don't know what's causing it. So going back to the hypertension example, if they don't know what's causing it, how are they going to fix it? Remember, your flat tire, your tires keep getting flat, but it's always the oil filter. It's always the oil filter. Just don't ask, it's always the oil filter, okay? So another couple of things, hypothyroidism. Hypothyroidism is diagnosed by too little TSH on a blood lab. But we already determined, right? Is the blood lab really legit half the time? I won't even pull blood on somebody unless they've been with me for 6 months, their diet's dialed in, they're off their meds, and then we can get a clear shot at their blood. I won't even pull it. I used to all the time. I won't even do it anymore. If somebody wants their blood just to see where it's at, okay, here's a $69 test, go down to, drive over to the blood lab, get it yanked, and I'll have it in my email by the end of the day. But we don't pull a bunch of blood with people. If you want functional medicine, go that route, and they will put synthetic nutraceuticals and megadoses into your blood to manipulate it the same way doctors do with meds, and then you will have your blood labs look just right, but you'll still feel bad. Does that make sense? Hypothyroidism is one thing. Thank you, darling. Hypothyroidism. So many people have hypothyroidism, but really are they telling you what is, remember, fabricated by the medical system. What is causing the hypothyroidism? They're not telling you. You know one of the top things? Get off the tap water. Super easy. Wow, what? Get off the tap water. Nobody ever told me that. Right here. Another couple things. I want to blast through some of these diseases to give you guys some answers, then we're going to have some show and tell, okay? Fibromyalgia and chronic fatigue. Fibromyalgia. Remember, fibro means fiber, myo means muscle, algia means pain. So fibromyalgia is just pain in the muscle fiber. But remember, what's the second word? Fibromyalgia what? Syndrome. So what does that mean? Where's it coming from? We don't know. Okay? Fibromyalgia syndrome. Here's another one that goes with fibromyalgia, just transposed by about a decade. One decade, everybody had chronic fatigue. The next decade, everybody had fibromyalgia. Same type of thing. Chronic fatigue syndrome. Chronic means long-term. Fatigue means you're tired. Syndrome means we don't know why. So we don't know why you've been tired for a long term. Chronic fatigue. But how many people go and they say, they went to the doctor, you're smiling, they went to the doctor and they say, well, they told me I got chronic fatigue syndrome. So they have a name now, but they don't have a reason. Where's the name come from and why do you have to have a name?
So you can get medicines.
I was just going to say, no, you're right on the money. Right on the money. So you can get medicines, but who's paying for it? Medicare. Insurance companies have to have a name. Insurance companies have to have the number that goes with it.
Our tax money pays for Medicare.
Yeah, exactly. It's crazy. So I'll tell you a little Medicare story here in a minute. Here's one that all the guys will love. Diseases that are fabricated by the medical system. Erectile dysfunction. How many of you, don't raise your hands, get Cialis and or, what is it? Viagra, that's right. Get emails all the time from, or phone calls or whatever it is, for these erectile dysfunction pills. Here's the deal. If you're on any one of the 3 drugs that we just had right there, you will eventually have erectile dysfunction. And if you're on any of those 3 drugs there, your chances for Parkinson's, Alzheimer's, neurodegenerative disorders, and all of the early onset dementia that you're seeing now goes up astronomically. Why? Because one's eating your brain, the statin cholesterol lowering drugs, one's eating your brain. You think a zombie apocalypse is not coming? I beg to differ. The other one, the blood pressure meds, they work by 3 ways. I forgot to get into that. They work by making your heart shut down. Those are your beta and calcium channel blockers. Or they work by making your kidneys work harder. That's your hydrochlorothiazide and all your diuretics, which just pump fluid out. And the other ones are the vasodilatory drugs, which will artificially inflate your arteries so as to lower the pressure to make you look good when you take your little wrist-held, handheld blood pressure reading at home. So if you're artificially blowing out your arteries, or you're shutting your heart down, or you're causing kidney failure long term, will that cause problems with your brain later? Yes. Then if you're taking blood thinners, do you think that's going to cause a problem with your brain later? Yeah. So you want to stay away from what we'll be talking about later this summer. I'm going to start I think I'm going to probably start a couple different segments of anti-aging, because that seems to be a big, big thing with people. They want to see how to get rid of the wrinkles. They want to see how to get rid of their chances of going to the old folks home 30 years ahead of time. And they want to get rid of the pain and the inflammation. Do I have to get my knees replaced? The doctors are calling me. I got my one knee replaced last year, and they put me on the calendar for 2 years out. Now they're calling me about the other knee. What do I do? We'll answer all that. So the erectile dysfunction, and this goes along with women, think about it this way, infertility. What is the number one reason why someone would have decreased testosterone or decreased progesterone or decreased estrogen? All of your sex hormones have to come from what you eat. They have to come from cholesterol. Notice the words. Estrogen, cholesterol, testosterone. Don't those words, in the very root of those words is the word cholesterol. They don't tell you that, do they? So you've got a multi-billion-dollar IVF, in vitro fertilization. You've got a multi-gazillion-dollar Viagra industry out there, right? So do these diseases really exist? Or are they propagated and promulgated and fabricated by the system that's already in place? Just by those 3 drugs that we just talked about. You're on one of those drugs, eventually they'll put you on Viagra. You're on one of those 3 drugs, eventually they'll put you on hypothyroidism drugs. They'll put you on the Synthroid. They'll put you on the levothyroxine. Real quick, ALS. I won't even get into ALS. It's not even worth talking about. The amyotrophic lateral sclerosis. Big word for Lou Gehrig's disease. This was a few years ago, and everybody was dumping water on their heads, ice water on their heads. And it's not really caused. See, you ever notice that? They never told you what caused it. They never told you what caused amyotrophic lateral sclerosis, Lou Gehrig's disease. But kids are dumping ice water on their heads all over the country, causing a big giant thing all over Facebook, and everybody's trying to be a hero for a disease that they did not tell you what it was caused by. There's a reason. There's a reason. There's something that causes it. We won't get into that right now. But the diabetes, statins, blood glucose. See, diabetes, it's very interesting because does anybody in here know anybody with diabetes? Every hand in this room should go up. So diabetes is very interesting because you'll notice, this is big. This is big. Blood sugar is now a disease. I was going to actually label that number 4 right there. High blood pressure, high cholesterol, deficiency in blood thinners. And we'll get to your question, Ann, in a little while about what to do about strokes. Don't let me forget that, because that's a good question. The number 4 right there was blood sugar. Well, your blood sugar is too high. No one in this room who's a patient answer this question. Let the newbies figure it out. Where does your blood sugar come from? I'm going to call on somebody. Anybody? Where does your blood sugar come from? Once you figure this out, you'll never forget it. Did you say something?
Just the amount of sugar in your blood from what you're eating. Sugar.
Hello?
It's in the name.
Thank you. It's right in the name. So how many of you know people who said, I went to my doctor and they can't get my blood sugar under control? No, your doctor can't get your blood sugar under control because you can't get it under control. It's the sugar that comes from what you eat. Where else is it coming from? It's that simple, Facebook. It's so simple. The blood sugar is coming from the only place it can, your face. Number 4, high blood sugar is a disease that does not exist. What diabetes is really a decrease in insulin. So what do we do with diabetics?
Give them insulin.
Give them insulin. But think about it. They already are eating. Do we change their diet? They're already eating. Wow, look at this. This is crazy. They're eating a bunch of sugar, right? They're eating a bunch of sugar. Huh? Oh, thank you. Thank you. That's why I have you here. They're eating a bunch of sugar, right? So we have to give them a bunch of insulin to cut the sugar down. Does that sound right?
No.
What if we decreased the sugar from here to here, would we have to decrease the insulin?
Yeah.
You bet. So the insulin would come down, right? So we're not fixing the insulin problem, we're fixing the sugar problem. This is the stupidest thing I've ever seen in my life. So you're wearing out the pancreas faster, and you're aging them faster by giving them a hormone. Insulin is not just some harmless chemical, folks. This is a hormone. It will turn on your aging process so fast. You want to know anti-aging? Secret? Don't get insulin. Secret? Cut the sugar. Interesting, huh? So does diabetes really exist the way that you've thought it existed for all this time? Because what are the other reasons behind diabetes? Somebody better say genetics that you've been told. I'm not saying it's true. I'm saying what are the other reasons why they tell you what's up?
Type 2 is a hereditary.
Okay, but listen to this type 1. How many babies do you know that were born with type 1 diabetes? 0. You know why? Because type 1 diabetes is acquired. How do you know? Kid age 16 years old, all of a sudden he's diagnosed with type 1 diabetes. It's acquired. How did he acquire it? Little kid, 6 years old, all of a sudden gets diagnosed with type 1 diabetes. Where did type 1 diabetes get acquired?
I've heard it's damage to the pancreas.
It can be. There can be a number of things, but what's causing the damage to the pancreas? Did the kid get kicked? Likely not. Right? So type 1 diabetes, think about it, huh? Can be. Can be, for sure. But if it's acquired, type 1 diabetes, think about it. If it's acquired, it wasn't genetic. If it's acquired halfway through their life, so type 1 diabetes should go on that list, shouldn't it? Now, if you're not getting the whole truth about diabetes, are you really getting the whole truth about heart disease? Are you really getting the whole truth about stroke? I just explained that one to you. Let me give you another couple. Congestive heart failure, Alzheimer's, dementia. We won't even get too much into that, just because you can pass those out, I guess. Oh, and give me these. Perfect. So Alzheimer's and dementia, they're telling you that's. What are they telling you about the purposes, not the purposes, the causes of Alzheimer's and dementia? Or you can just leave them there and they can pick them up on the way out.
Age to some.
Age. Yep, just old age. Yeah, you'll forget where you live. It's just natural. You'll forget the faces of your kids.
I can't wait.
Yeah. Oh, yeah. Yeah, you'll forget what your kids look like. Natural. No big deal. Happens to everybody. It's just a natural part of aging. No way you can stop it. Nah, let's just make sure that's not what you believe. So the anti-aging thing will include how to get around Alzheimer's. She's correct. The Alzheimer's is now called type 3 diabetes. Interesting, huh? So does that tell you that it has to do with, if diabetes has something to do with your diet, does Alzheimer's have something to do with your diet? Huh. Interesting, isn't it? It's insulin sensitivity, insulin resistance of the brain is what it is. And there is ample evidence showing that the amyloid plaques that are caused by, that actually cause Alzheimer's or Parkinson's, all the beta amyloid plaques in the brain are actually particles of certain things that were ingested, breathed, or acquired. We won't get into exactly what those things are. But then the beta amyloid, the plaques in the brain are actually a result of the body's trying to fight things off and wall things off. But what if you could reduce the amount of stuff that gets into your brain? What if you could reduce that so that the beta amyloid plaques don't take over and cause all this crowding and atrophy of the brain tissue, right? Can you reverse it? Depends on how fast ahead of it you get, how far ahead of it you get. So yeah, you're right, absolutely, good point. Screening demonstration. You want me to show you something? Or you want me to use you as a screening? So what do we do here? How does this work? Is this yours? Oh, it's okay. You can keep it there. Just making sure. So we will, well, do you have grab a couple of things and so what we do, we'll show you a brief demonstration of how this works. It's very, very, very simple. The chiropractic, everybody gets that. The detoxification, we use infrared saunas. We use ionic detoxification units. One is for your whole body. One is for your feet go in water. But then the big purpose is it's not sucking anything out of your feet. The big purpose of it is there's an ionic field that all of your blood, which travels through your feet, goes through a number of times in this 23-minute cycle. What that does is it gets all the blood into your internal organs, much more oxygen. So you're able to handle a lot of detoxification. Your lungs handle the air, your kidneys handle the water, your colon handles the food. Food, air, water, boom. It's not sucking a bunch of stuff out of your feet. You could think of it that way if you'd like, but really the purpose of it is later on for you to increase your urinary output, your bowel output, your breathing, and to really detoxify from the inside out. The infrared saunas kind of operate on the same principle, only it's a whole body thing. So here, just to give you a quick example, okay? Well, yeah, don't look at this. We'll do this. Oh, let's use this. This is fun. Okay, so close eyes. She has no idea what I'm doing. She doesn't know which thing I'm using. Actually, I'm going to trick her. I'm going to get tricky. I'm going to get tricky. Put your right hand out. So if your body is as smart as we know it to be, it should be able to sense a difference between things that we put in it or on it and things that are good for it and then things that are bad for it, right? This is not hocus pocus, new age mumbo jumbo. This is just giving your body a little bit of credit for knowing what's on it and around it. How many of you have ever walked into a room and been able to feel the mood without hearing a word? Yeah, okay? So your body is much more sensitive to things than we would like to even believe. So what I'm going to do is find a strong response here. Okay, now she has no idea what I'm doing. I'm just going to put this here. Okay, so I'm just finding a normal response and just seeing if that changes anything. Y'all are going to be at home testing your potato chips tonight. So there's a marked weakness there. Now, she's not, paralytic or anything like that. You can just tell that there's a marked weakness there. I'll check this one. Okay, if I take that away and if I use this, not an inch of give right there. Good, solid response. So we do this for two reasons. I'll get to that in a minute. Now here is something. How many of you know what this is? How many you don't? You know? All you guys know what this is? How was I clueless? I had no idea. Somebody brought this in and said, "Test me for this," and I was shocked. I had no idea what this was. I guess they use it for tats and stuff. I don't know. Hold that. Is that what it is? Wow, look at this. So look at that. Look at that. You know what this is? You can open your eyes. Huh? Yeah. This is, I had a patient who was let me see, I believe she was she was a nurse, actually. Or maybe a respiratory therapist. I believe she was a respiratory therapist. And she came in and she'd had allergies and asthma forever. It all cleared up in about 4, 5, 6 weeks, I believe. She came in one day because she said, she overheard us talking about, well, we test people for their supplements and other stuff they're taking, their drugs. If somebody wants to see what the metformin and the insulin does, it's a very simple thing. Come here. Put it right here. No, I'm sorry. She's that responsive, I tell you. Come here. Let's just check this out, and you'll feel it. So put it in their hand, and it tests, or it doesn't. Same thing. She said, "Can you test me for this?" And I said, "Sure." And I just put it on her body. And she was laying down already, and I was like, "What is this stuff?" And I looked and I said, "Advanced Therapy Healing Ointment Aquaphor." Okay. I said, "What is this?" "For dry, cracked, or irritated skin." She said, "My dermatologist put me on it when they gave me the Retin-A or the retinol or the Accutane for the zits." She had acne, really bad acne when she was a kid. So, of course, the Accutane dried up her lips. But she didn't equate that her lips were made of skin, I don't think. So she went to the dermatologist, thank you, and the dermatologist prescribed her this, which is a chemical for her lips. Now, listen to what it says on the back. I read this to her, and it was that day. She said, "Yeah, you can just keep that." "Keep out of reach of children. If swallowed, get medical help or contact the Poison Control Center right away."
Okay.
Where's she putting it? Right here. Isn't that crazy? The dermatologist gave her this. You had what?
I had precancerous thing on my bottom lip. It was really painful.
Jennifer said precancerous. I'm just going to repeat for Facebook. You had a precancerous lesion on your lips, and they gave you this, which is a poison. You can look at the active ingredients. You can look it up, read it, see what it is. It's right there under your nose, folks. Literally, under your nose. See what I did? All right, so So the nutrition testing, the detox and the chiropractic and the laser, that's all fun and games. But the nutrition is what rebuilds your body while you sleep. That's why it's so effective. That's why when I go on vacation in the summer for 3 weeks and I go on vacation over Christmas for 3 weeks, I come back. And is everybody getting better or worse? They're better than they were when I left. Why? Because the nutrition's rebuilding their bodies while they sleep. Sure, we're still doing chiropractic, detox, laser, all the other stuff we do here. We use everything from whole food nutritional supplements, which is what this was, by the way. This is whole food. This is plants and animals. That's it. So we do all that stuff, of course. We do everything from whole food supplements all the way up to homeopathic stuff, Native American stuff, herbs. We use stem cells. We use all kinds of stuff. German new medicine, liquid drainage remedies. We use all kinds of crazy, botanicals and herbal botanicals and liquids and all kinds of stuff. But when we rebuild organs little by little over time, people just continue to get better. It works whether it's female, male, big, small, young, old, infant, child, breastfeeding mother, it doesn't matter. If it's dogs, if it's cats, it doesn't matter. They just get better. It's physics, it's physiology. You can't change it. So just another couple things. Everything that we're doing here, design clinical nutrition, it's designed specifically for each person. You come in, if you have chronic fatigue or fibromyalgia or high blood pressure or whatever, it's not just a cookie cutter, here, take lisinopril. Here, take levothyroxine. Here, take Synthroid. Because guess what? Your fibromyalgia or your non-existent disease state will be different than someone else's non-existent disease state, right? So that's why the protocols don't work. That's why the drugs don't work. Does that make sense? So it's designed clinical nutrition. Hypothermia, we won't even get into that. There's no magic protocol, but you can expect miracles. Why? Because we're working with the body instead of trying to poison it. It's not quick, though. I will tell you this. Sometimes you'll get results. Usually we get results within about 6 days. Well, usually when they start taking the supplements, they get results in 2 days, but we don't see them for another week. So within about that 7-day period, they come back and they're a different person. I mean, anybody in here who is a patient or is a patient that can attest to that? Like within about the first week, you'll feel a difference. I promise you. You start doing then beyond that, you make the dietary changes and things that we tell you to do, and you'll start feeling better and better and better. You'll start climbing the hill. Might take, if you've been sick, on a bunch of meds, missing a bunch of organs, had a bunch of replacement surgeries, this and that, you're on a handful of meds, it might take a few months. It might take 9 months, 2 years. I tell some people, don't even get started unless you're able to give me like 9 months, give me 2 years. If you've been on 35 years of downward steady decline, give me a year, give me 2. But if you're brand new to this, you've got some aches and pains, you've been diagnosed with something, you don't like the options of drugs and surgery, you want to come in, hey, you're young, you're healthy, you're on no drugs, let's do this. Give me 6 months, guaranteed. Guaranteed you'll feel like $1 million. Pretty much done here. We want to hand out Hannah's going to go ahead and hand out the screening sheets here. If you're interested, first of all, if you're a current patient, fill it out. Tell us what we're doing great on. Tell us what we are horrible at. We want feedback.
Don't worry, don't be shy. We want your guys' feedback.
Don't be shy. If you don't like my hair, tell me. I love you too, darling. So if you don't like our black scrubs, tell us.
Yes.
If you don't like the green pews, tell us. And then donate money so that we can buy different ones. But if you're a current patient, tell us what we can do. If you're somebody who just walked in for the first time, fill out the paperwork and tell us, answer some of the questions like, hey, what would you like to see other classes on? Oh, let's do one of those too. There was something on there I was going to ask about. And we're never going to share any of your info. If you want to start handling conditions listed above now, yes or no. What made you decide to come? The most common answer to that is my wife. That's the most common answer. What health topics would interest you? What can we change or improve? How'd you hear about us? So at the bottom there, if any of you are interested in a screening, in getting screened, the way that I just showed you how we do that with Hannah, we'll test and see if you're actually a candidate for nutrition response testing.
By the way, just please make sure that when you fill those out that you get them back to either Sarah up front or I.
Yeah, if you fill these out, let us know.
This is feedback. You guys are all very important to us, so we want to know what you have to say.
Yes. So get those sheets either to Hannah or Sarah or Miss Faye if they're running around here. Make sure you hand in those sheets. We want to know what we're doing well. We want to know what we can work on. We want to know what your thoughts are. Come back, see what we're doing. In 2 weeks, the most evil substance on earth we're going to talk about. It's not heroin. It's not. It's not. You'll see. You'll see what it is. But so we're going to sign out for now. Facebook, thank you. Any responses, questions, comments, concerns? Fabulous. Love you, Jamie Hayes. Thank you all for joining us. We'll see you in 2 weeks. Back here, same time, same place. Signing off. Thank you, Facebook.
Trying to keep up in all this chaos. I need you now. When my life is in a state of flux, I will lean on the constant love of Jesus. When